Every so often with sports injuries, we're forced to stop thinking just about the effect on their playing career and instead focus on how this injury might affect just the rest of their life outside of sports. Spinal cord injuries are much more common outside of sports, but regardless of when they happen, they can be a very disabling injury for the individual. Welcome back to the channel, everybody. For those new, my name is Brian and I'm a doctor and a sports fan, and it's my goal on this page to combine those two interests to look at different sports injuries and sports medicine topics and explain them in a way that's easier for you to understand and learn from. Today we're going to be taking a look at Ryan Shazier's spinal cord injury that nearly left him paralyzed. So if you're a football fan or just a sports fan in general and want to learn more about this injury and spinal cord injuries, then stick around because this video is for you. As always, feel free to subscribe if you want to see more of these videos. Hit that thumbs up if you enjoyed it. What we're going to do today is take a look first of all at the actual injury itself to see if we can learn anything about what happened to Ryan Shazier. Next, I'm going to review some basic spinal cord and nervous system anatomy so that you can understand why injuries to the spinal cord might leave athletes with different deficits. Then we're going to talk about the basics of how doctors classify spinal cord injuries and how we evaluate them. And then finally, we're going to talk about how we estimate whether or not a person's going to walk again and the implications for Shazier coming back to football. Let's get right to it and take a look at the clip. And you've probably seen this before, but as you probably remember, there really wasn't that dramatic or high speed of a hit. I think the key thing here is the position of his body as he's making the tackle. Our spine has a natural curvature to it that helps it absorb impact and load. And anytime we take some of that natural curvature out of our spine, we subject it to higher stresses. And so we can see when he makes the tackle, his back and his head are more straight, and that's probably part of what precluded him to getting this injury. Afterwards, right away, we see him grab his back, implying that he might have had some pain in his low back, and then fall to the ground and basically roll over, unable to move his legs from what it looked like on the field. Initially, his injury did not require surgery, but then within a couple of days, he did have spine stabilization surgery, implying that there was some instability, potentially fracture to his low back. We don't know exactly what the specific type of injury was, but we know that he had some sort of spinal cord injury. Oftentimes with football players, we see this more commonly in the neck, because if they lower their head down to make a tackle and then spear somebody, you've removed that natural curvature of the cervical spine, and so you subject it to higher loads. So a low back injury is not as common in a professional athlete as, say, a neck injury, just because of the mechanism and the way that they're tackling. Let's go next to our anatomy to learn a little bit about the nervous system and the spinal cord. So we can break our nervous system down into the central and the peripheral nervous system. The central being our brain and spinal cord, and the peripheral is all of the nerves that leave the spinal cord and go out to our body. We have different sections of our spinal cord, and these different sections correspond with different functions and movement in our body. So the cervical spine is at the top, and that's controlling the movements of our arms. Next, going down the thoracic spinal cord, that's more involved with our chest muscles and our ab muscles, but then also helps control functions like our heart rate, our blood pressure, our digestive system, and so on. Then below that, we have our lumbar spinal cord, and that's where the majority of control of our legs come from. Finally, at the very bottom, we have the sacral spinal cord, and that's helping to provide control to our bowel and our bladder movements, as well as some different sex functions. So you can imagine how an injury to a different spot in the spinal cord is going to give you different side effects. In general, we think that the higher the injury is, so the closer it is to the brain, the more potentially severe it can be, because it can affect everything below that level. Now, we don't know exactly the level of Shazier's injury, but we can imply from the footage that it was probably somewhere in his lumbar area in the low back, which is good because that tells us that everything above this should be fairly well preserved, and it's really just everything below that might be impaired. The other thing to remember too about our spinal cord is that not only is it sending signals to our muscles from the brain going down, but it also receives input from things like our fingertips and our skin and sends those signals back up the spinal cord to the brain. So whenever we have an injury to the spinal cord, not only is it going to prevent things from the brain getting down through, but is also going to prevent things from the arms and the legs getting back up to the brain. If we take a look next at a cross section of the spinal cord, we can see the different regions and what their functions are. And there's a lot going on here, as you can see, and there's a lot of different functions that our spinal cord needs to do. Not only is it muscle control and sensation, but also things like balance, coordination, temperature control, pain control, all these different features that are in different areas of the spinal cord. So depending on where the actual injury is, you can pick off different functions. Sometimes we'll see patients who have just paralysis, but their sensation is completely fine. Other times their sensation is completely gone, but they are able to move their muscles just fine because of the area damaged in the spinal cord. We know that Shazier, they said, had some sort of a spinal contusion, which you can just think of as a bruise. And so depending on where this bruise was in the spinal cord, will leave him with different deficits and disability. Moving on, how are the doctors classifying this sort of an injury when he gets to the hospital? The big categories we think of are complete and incomplete. A complete injury is more severe. Think of it as a more complete damage to the spinal cord where not as much is getting through either direction. As opposed to an incomplete is going to have much better outcomes. They're probably still going to have some control of their muscles and sensation below their injury. It might sound kind of crude, but the way we actually test this, and what I'm sure they did when he got to the hospital, was with a rectal exam, because those bottom levels of that sacral spinal cord control the muscles around our bottom. And so the way we determine if it's a complete or incomplete is whether or not those lowest levels of the spinal cord are preserved and still working. And that can have a lot of prognostic information and overall indicate how severe the injury is. So it's one of the first things they're going to be doing when he gets to the emergency room. Now, the more detailed classification of these injuries is a lot more intricate, and I'm just going to put a picture up here for you to take a look at. And this is the form that doctors go through whenever they're trying to classify a spinal cord injury. And I'm sure this is a test that Shazier had done when he got to the hospital. Basically what we're looking at here is we know that every level of the spinal cord has a certain function that we can test, and that makes sense. We want to see how every individual level is working. So for example, in the cervical spine and the neck, our fifth nerve root, we test by measuring biceps or flexing the elbows. Down in the legs, the L3, the lumbar third nerve root, we test by checking extension of the leg or the quadriceps muscle. Similarly, all these different nerves coming off of the spinal cord control sensation in a different part of the body. And so all these different little points you can see on here are the areas where we check to see how well the sensation is intact after a spinal cord injury. So doctors like myself will actually go through and do this complete test. We check every single muscle, we check every sensation spot, to get a clear classification of where his injury level would be. And now to finish off with why this is important and why we need to do this classification is because it can relate to prognosis. There was a paper that came out that was trying to look at what can we use on the exam to predict the chance that a patient will walk independently after 1 year of having an injury. The key points they used, I'm going to pull up here in this box, and if you remember from our chart the different levels that we test, they looked at two key levels. They looked at the third lumbar level and the first sacral level. That's that L3 and S1 here. So at both of those levels, they check the muscle and they check the sensation, and they come up with a total score with a higher number, meaning more function is still there. Next, they take that score and they go to this plot where they can go across the bottom axis and put that actual total number. And then as you go up, wherever they land on the curve seem to be what they found from their research as the predictive percent of chance that a person would walk independently after 1 year. Obviously, there's a lot of variety in this. This is just research data. It's not hard fact that we guarantee patients are going to have as their outcome, but it can give us a general idea of the chance that they will be able to walk, because that's usually the first question they ask. We heard from stories that Shazier's doctors told him 20%, and I don't know if they were using data like this or some other data to make that prediction, but we can see about where 20% falls on here, and that implies that there was definitely some function in those muscles after his initial injury. But still, 20% is, fairly low. That's only 1 out of 5 people that will be able to walk after 1 year. Now, is he going to play football again? Think about all the things that go into playing football. It's great. We've been able to watch his progress and see from him walking across the stage at the NFL draft to then walking across the field at a football game. We've seen him standing up. We've seen him initially in his wheelchair. We've been able to follow his progression, and we heard that most recently he was able to jog on his own for the first time. So this is all extremely reassuring and really great, and he's definitely ahead of the curve for someone with a spinal cord injury. The hard part though is with all of those more intricate, fine tasks that he needs to do to be able to play football. Sure, you might be able to walk and run, but do you have the quickness? Do you have the agility? Do you have the coordination to do everything you need to do at the high level required for the NFL? Only time will tell, but the fact that he's made such great progress is really reassuring, and we know that nerves can heal. You can help retrain nerves, and so it's reasonable for him to be working back towards this. He still has a huge amount of odds to overcome, but anything really is possible, and there's no reason to discourage him and say that he definitely can't. There shouldn't be a medical reason why he can't go back out on the field. I'm sure his doctors are probably telling him not to, just because they don't want to see him get hurt again. It's really just a question of how well he can function to get back those playing skills. That is it for this video, everybody. Thank you as always for watching. I hope you enjoyed it, and I hope you learned something about the basics of spinal cord injuries. Leave any comments below with other questions you have or thoughts on any other video. And until next time, thanks for watching, and we'll see you later. Bye.